Have you ever been diagnosed with IBS constipation, IBS diarrhea, or IBS mixed, or also known as IBS-M? Do you have severe constipation but no diet change, supplements, or doctor visits have helped? Do you have anxiety, fatigue, and weight gain despite doing lots of things to manage all three? Or do you flip between constipation and getting diarrhea and you have no idea how to stop the cycle or why or how you even get both? Or lastly, do you have unexplained diarrhea that diet changes and supplements also haven't helped? If you said yes to any of these questions, then you may have a pathogen called Clostridium difficile, or for short, C. diff. Continuing with week 5 of our 7 pathogen series, today I'm going over what Clostridium difficile is, common C. diff symptoms, less common symptoms of C. diff that you more likely have, how C. diff is spread, how long C. diff can last, the best chronic C. diff testing you can do, why C. diff often gets overlooked, and how to identify a good and a bad C. diff protocol. I'm going to debunk every single myth around C. diff that I can think of because the number one reason that clients who work with me aren't feeling better even after all the work they've done on their health is because all of the little things that can go wrong and get overlooked. In part 5 of the series, I'm pointing you to the fastest way to heal from C. diff because no pathogen needs to be ruling your life. It's time for you to feel your best, have energy, and get back to your life. It's time to find and kill some C. diff. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormone, skin, sleep, and brain concerns. Literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. Hello, and if you are new to the Better Belly podcast, might I just say welcome. We are in the middle of a 7 pathogen series. These 7 pathogens are the 7 pathogens that are causing the problems for my clients' health and 99% of my clients. And when they're not feeling better, it's either because the pathogen wasn't looked for, they were given a really bad test that couldn't even see the pathogen and it actually is there. Unfortunate but true, or they were given a bad protocol that didn't actually deal with it, or my personal, favorite, least favorite, how do you say that? My personal dislike of all time is that only one pathogen is looked for, and it's assumed you only have one pathogen, which why should that be the assumption? And so you kill one thing, but you don't realize you have 1 to 3 other things going on in your body. So of course you don't feel better after the protocol, but you think you need to do, a second parasite cleanse, a third one to feel better, and you don't feel better. It's because you don't have a parasite anymore. You have other issues. So today we're talking about the pathogen C. diff, or its longer name is Clostridium difficile. It's a bacteria, and the difficile literally stands for difficult, meaning it's difficult to kill with antibiotics. It's just resistant. And so this is not meant to suddenly darken the tone of this whole episode. Like, it's impossible to kill. We kill it all the time for our clients. But just to say, it changes where you are most likely going to get this pathogen. That's the biggest implication for you today. But before we jump into that part of the episode, we're going to start from the beginning, and we're going to just talk about signs and symptoms. Then we're going to talk about what the type of pathogen this is, where it likes to hang out, how you get it, reasons someone might test you for it, or honestly just not test you for it, because that's a big question of why is this getting overlooked? What test I recommend you do for this pathogen, what the best test is, and then how to identify a good or bad protocol. Plus some food recommendations at the end of this episode. It's going to be super juicy. So, of course, we're going to start off with probably everyone's favorite part, which is symptoms of this pathogen, because this is our own little way to just do a personal diagnostic tool. It's not a test, but it is hey, do I even sort of map onto all of these symptoms? So let's talk through this. Number one big symptom you're going to find with C. diff is increased or unexplained anxiety. And if you want to dive deeper into this symptom and be talking about it more, go check out episode 41, which is linked in the show notes. It's called Anxiety, Depression, or ADHD, One Reason to Check Your Gut. And I talk about C. diff. C. diff basically alters your conversion of dopamine into norepinephrine. So you get an imbalance in those two. So you get super high levels of dopamine and low levels of norepinephrine. And that can affect your mood. It can affect your focus. It can affect your ability to lose weight or gain weight. It can affect all sorts of things. So, but especially things that your neurotransmitters control, like your mood and focus. So big thing interesting there. If you have increased or unexplained anxiety, it might not be your life. It might not be your stress levels or your ability to pray or meditate, or it might not be your job. It might not be your kids. It could be C. diff. And I actually have some stories I'm going to share throughout this episode of 3 different clients of mine who had C. diff. I'm going to talk about where they got it, signs that they had it, and then how we found it on our testing and what their life was like once we got rid of it. I mean, just mind-blowing stories. And one of them is going to be an anxiety story. But for now, go check out episode 81 if you want to, or episode 41 if you want to learn more about that. Other symptoms of C. diff is going to be diarrhea, which is the heralding mark of C. diff in a hospital setting. But usually it's not going to be like, I get diarrhea and I have to rush to the bathroom. It's going to be watery diarrhea. You're getting so frequently that we're actually worried that you're going to dehydrate, and it could be significantly harmful to your health, if not life-threatening. C. diff in an uncontrolled environment, if you have an acute case of it, can be life-threatening. And you typically would not be listening to a podcast like this if you had an acute case of C. diff. And that is, we're already touching on the number one reason C. diff gets missed and why people just walk around being antagonized by this pathogen is because doctors are only looking for acute symptoms of C. diff. So if you do not show acute symptoms, meaning the super watery stool that's basically landing you in the ER, they don't even think there's a snowflake's chance in hell that you have it. And you actually could, because interestingly enough, when you get chronic C. diff, meaning it's not new to your system, but you never booted it out, so it's still hanging out in low but not helpful levels, then you can get both diarrhea on that less severe level, but you can also get constipation. And that's been one of the most interesting things. My very first client who I found C. diff with, she had no diarrhea at all. She had constipation. That was a symptom of hers. And so, I mean, it's the complete opposite side of the symptoms that someone's looking for if they are a doctor. But constipation is a huge symptom of chronic C. diff. You can also then get that mixed diarrhea and constipation. Basically, your body doesn't know if it's trying to poop the C. diff out and get rid of it, or if it's going to freeze up and hold on because it's being attacked and it's trying to basically attack this with an immune system response of your white blood cells, opposed to just pooping it all out, which is more where the diarrhea comes from. So you can oscillate. You're going to abdominal pain, cramping, general inflammation, leaky gut is a big problem, increasing food sensitivities, joint pain due to the systemic inflammation, meaning you have inflammation markers in the gut from the pathogen that gets absorbed into the blood. The blood goes everywhere into your body, including your joints, skin, muscles, and then you get joint pain, muscle pain, stiffness. That's called systemic inflammation. You can have brain fog because of the blood, that inflamed blood going to the brain, poor memory because of how C. diff impacts that dopamine conversion to norepinephrine through, it impairs the dopamine beta hydrogenase enzyme. And it's called DBH if anyone wants to look it up. And then it can also either worsen or give you symptoms of ADD and ADHD. And you can learn more and hear more about that on episode 214. The title is this gene mutation making your ADHD worse? And I do talk about a gene mutation called MAOA, but I also talk about C. diff in that episode and its role in antagonizing the MAOA gene mutation. So if you like genes, if you like C. diff, if you have ADHD or ADD, go check out that. And I guess ADD is an old term and it's not used anymore, but for anyone using that term still, go check out that episode. Other symptoms you're going to be looking at is depression, kind of on the flip coin side of anxiety, adrenal fatigue or low energy, unwanted or unexplained weight gain because of how it impacts norepinephrine, which is like a get up and go hormone. It gives you some energy and some pep, so it can make you gain weight and also be super tired to not have enough of that. Hormone imbalance, PMS, and liver dysfunction, or you could call it liver congestion, but basically the liver is getting built up with toxins. It is not like a disease of the liver. So you're not going to be at the point that a doctor is going to say, hey, your liver is in a disease state, but it's on the scale on your way to a disease state. You don't just go to 0 to 100. You actually would slowly progress. So some type of liver congestion. And this can result in a wide variety of symptoms like skin issues, sinus issues. If you want to learn more about that, we have an episode that I did not pull up in my notes in advance. Let me go grab it real quick. It is episode 118, liver, the number one thing you can do to ease bloating and PMS. And I'll put that in the show notes. And then we also have, if you're like, I do have skin issues, I do have sinus issues, we have a great episode on the gut-skin connection, which I'm going to put in the show notes, and a great episode on the gut sinus connection, which I'll also put in the show notes. These are going to be episode 45 and grabbing the sinus one, episode 47. Perfect. All right. You guys will have all that in the show notes. So that's all your symptoms that that I'm generally looking for. If someone's, and honestly, can you notice that, we're constipation, like everything that we started working in Better Belly Therapies was gut related. We have ended up working with autoimmune conditions and skin issues like acne, eczema, psoriasis. We've worked with sinus issues. We've worked with all sorts of things, brain issues, insomnia, fatigue, and resolved these things. But you can see how C. diff is just one more thing that could potentially be causing your constipation or your diarrhea or your abdominal pain. And if someone's not looking for it, you could actually be having it and they're trying to treat something else, candida, but it's really C. diff that is causing the bulk of the issue. So it's very, very important to get it checked out. And checked out in an appropriate way, which I'll talk about in a second. So it is a bacteria in the body. It hangs out in the large intestine. When you have it, it is not commensal, meaning it's not good for you. There's no appropriate amounts of C. diff to have. Where you get it, this is the most aha moment for my clients who have C. diff. Most of them can figure out where they got it. So the majority of ways you're going to get C. diff is human-to-human transmission. And the most common way you're going to get that transmission is in a hospital setting. So let's say you go to the hospital to deliver a baby. You go to the hospital to even have a procedure like a colonoscopy, let alone a surgery where you're getting cut into. You go to the hospital to visit somebody. But especially if you are there as yourself as the patient, you typically are going to have a lowered immune system while you're there. Delivering a baby is exhausting, or being put under with anesthesia. They're things that don't increase our vitality. We're in a weakened state. And C. diff, it's called Clostridium Difficile. It's hard to kill. And so it's really prevalent in hospital settings. Even doesn't necessarily mean things like look dirty. It's easy for it to be transmitted around the hospital just because it's hard to kill. It's resistant. So that's going to be the number one thing as a hospital. A lot of my clients who've had C. diff, they'll say, all my symptoms started after a hospital stay. That could have been giving birth. That could have been, blood transfusion. That could have been a surgery of some sort. That could have been like back surgery. I've had all sorts of surgeries, gallbladder surgery. It'll be like right after that. And they think it's the surgery that did it, or they think it was the trending direction of their health, but it didn't help that maybe they picked up C. diff while they were in a hospital setting. And then the other way is sharing it with a family member. So people who are more likely to get C. diff are going to be the elderly. It's just a thing. Their immune systems are weakened. They spend more time in the hospitals, potentially just from getting checkups or falling and hurting their hip, whatever it is. It's no fault of theirs, but they are more likely to have it. So if you have a grandparent who gets C. diff and you go visit them, maybe you were young, maybe you didn't realize what they had, you didn't realize it was transmissible, but you can get it from them too. Maybe they don't realize they have it, but I looked up what's the percentage of population that has C. diff? It's between 1% to 3% is the estimation. So it's one of the pathogens that has the lowest amount of numbers. Like H. pylori has like a minimum of 25% of the population has it, but some of the percent of the population's asymptomatic. I've never seen anyone talk about having C. diff and being asymptomatic, but the problem is that conventional medicine and even functional doctors still think of C. diff primarily as an acute infection where you're going to get this watery diarrhea, and that's more fit for an ER setting. So many people are just not thinking of testing or looking for it. But a really good reason that a doctor should be thinking about testing for it is if you switch between diarrhea and constipation, you're diarrhea prone or you're constipation prone. Almost immediately, I'm curious about your C. diff status. If on top of that, you have anxiety, difficulty regulating your emotions, difficulty focusing, you have a history of staying at a hospital for whatever reason, or you even have a history, I usually don't do this in my intake, but I've had 2 clients now who had C. diff. They had histories of working in a C. diff ward. One was a nurse and one was it was like an assistant. They like took notes and stuff, and they managed paperwork. And they said, "Oh, I worked in the C. diff ward for a few months, like an internship or a few years, and I'm not a nurse now, but they have this chronic C. diff." Or you know that you had a family member who had C. diff. These are really great reasons that a doctor or a functional health professional might think to treat you. And reasons practitioners don't treat people for this, like I've said, I think 2 or 3 times, is that they only think of the illness as an acute issue that is best treated at the ER. It's like I tell people all the time, if you had an acute C. diff infection right now, you would not be listening to this podcast. You would not be in my office. Whatever interaction I'm having with that person, I say, you would be kind of heading yourself to the ER because your diarrhea would be so watery and so explosive. And so that's, again, why you don't realize that that's the case, but that's what's going through the doctor's minds that's making them not even think of testing. So the question now is, what testing can you do? I am not as familiar with the testing that they do in hospital settings for C. diff. I know that they can find acute C. diff and they know how. I've never had a client actually get a C. diff test, like tell me I was tested for C. diff and it came back negative, just because I think by the time you don't have watery stool, they are not testing you. So the only test I'm familiar with that I can speak words on is the functional lab testing that I do myself. The best one that I recommend is an organic acids test. We use the one by Mosaic Labs. It has C. diff markers on the very first page. And then additionally, you can compare a marker called the HVA-VMA ratio, which is actually metabolites of dopamine and norepinephrine. So it'll look at, you want to have a 1-to-1 ratio of HVA and VMA. And if on your organic acids test, it's closer to a 2-to-1 ratio, meaning HVA is close to double what your VMA number is, that's a big sign of C. diff, because C. diff, again, it causes a backup of dopamine, and then you have low levels of norepinephrine. So you're going to get, instead of it being 1-to-1 ratio where your dopamine's being converted at a regular rate and you're getting that nice dopamine norepinephrine balance, it's not balanced. You're going to see a 2-to-1 ratio. Another way you can do this, if somebody happens to run a Dutch test on you, which is a hormone test done with your urine, it's typically to focus on sex hormones and cortisol, adrenal hormones specifically. But the very last page of the Dutch test, as of now, includes additional what they call organic acid markers of a variety of sorts, but it does include the HVA, VMA markers. And it doesn't do a ratio for you, but if you literally look at HVA and it's like 6.0 and you look at VMA and it's like 3.0, that's a 2-to-1 ratio. And that's actually how I found my very first person's C. diff, is we didn't run an oat, we ran a Dutch. And when I got to the bottom and I knew about this HVA-VMA ratio, I said, whoa, this is crazy. I think you might have C. diff on top of everything else going on. And so we tested for it with the oat to confirm it. She totally had it. We got rid of it. Her health changed. So the story of that client is really interesting. She was a mom of 5, former nurse, and her husband's a pilot. And so he would be gone for days on end, or sometimes be so sleep deprived that when he came home, he'd have to sleep through the day and then fly at night. And so she was doing a lot of solo momming. She loved being a mom. She wanted to be engaged with her kids, but she was being stopped from like some really notable things I remember from her story is she couldn't finish making dinners sometimes because her stomach would have these stabbing pains and she'd have to go lay down because they were like taking her breath away. Or she'd be watching a movie with her family and her husband there and she's wants to be with them, but she'd have to walk away and like go lay on her bed and because of these stabbing stomach pains, like very, very intense. And so I thought, let's make sure you don't have H. pylori. She did. But at the same time, when we got all our lab testing back, I would have not gotten her, you could say either any results or nearly as good results if I said, we found one pathogen, you have H. pylori, that's it. No, you want somebody who's going to be thorough. And that is a huge, huge, huge reason people are not getting results. You could have a perfectly fine protocol to kill your whatever, C. diff or whatever it is you have. But if your practitioner is not looking for the big picture, it's like saying we're going to clean up your kitchen, but we're not going to look at the rest of your house. Yes, great, you have a clean kitchen now, but the rest of your house has not actually been dealt with. And if you paid a cleaning company to clean your whole house, you wouldn't be happy if they only cleaned your kitchen. You'd be like, okay, thank you, but you only did like a quarter or a fifth or a tenth of your job. Like what about the bathrooms? What about the bedrooms? What about the living room? What about the playrooms? Whatever rooms you have, you'd be sad. And because you as a consumer are not the expert, you don't realize that you are having rooms completely missed, rooms of your health being completely missed. And that's why you don't feel better when you're done with your pathogen protocols. C. diff is one of the ones that tends to get completely ignored and yet is present. So when we did testing on that client, that nurse, she had C. diff and she said, oh my goodness, Allison, I was a nurse on a C. diff ward for years. And I had no idea prior to that point of saying, I think you have chronic C. diff. And sure enough, we dealt with it and her stomach pains went away. And you can actually hear her story I didn't even think of sharing this. So let me go grab her episode. It is episode 113. We actually have 2 episodes from her. Episode 113, Crush Abdominal Pain and Get 90% of your Energy Back. Her name is Desi. And so you can hear that episode. That's part 2. And then part 1 is going to be episode 35. Get rid of abdominal pain, joint pain, fatigue, lose 10 pounds, and feel better than ever. Who doesn't want that? So that is Desi's part 1 and part 2 of her healing journey, where we got her story 3 months into healing and then 6 months. And you can kind of hear how much progress she made in 3 months and then how much even more progress she made at 6 months. All right, so what are signs of a good protocol for C. diff? You want to have your pre-pathogen protocols to strengthen the body or strengthen vitality. These are things like giving your body nutrients, starting to bind heavy metals, supporting digestion. These are a foundational part of my program, the Better Belly Blueprint, which you can learn more about when you go to betterbellytherapies.com/training. And you can get access to all of these protocols, all of this testing, find out if you have C. diff, and just boom, 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 check every room of your house, so to say, the metaphorical house of your body, and find exactly what's causing all your symptoms that no one else has found. So you want a pre-pathogen protocol to support the vitality of your body so your immune system can work with you. You want things that are what we call biofilm busters. They break down biofilm, which is a protective wall, kind of like how a castle has a wall around it. Pathogens will put a wall around themselves called biofilm to protect themselves from killing agents. So you want a biofilm busting product. This is typically going to be your oregano, your olive leaf extract, things that are in a lot of products that when a client sends me a protocol, I'm like, yeah, they gave you biofilm busting products, but there's no powerhouse supplements, which is what I would call the supplement or agent that is going to kill that specific pathogen. And it's different for every pathogen. So that is hard for you as a consumer to know, like, which one it is, but I give it to you directly in my program, the Better Belly Blueprint. And then you want a detox and diaph manager, meaning something that is going to absorb the toxins that this pathogen is going to kick out when you try to kill it. C. diff is probably It's one of the two pathogens that has the most gnarly die-off most consistently for my clients. So die-off meaning you can also call it the Herxheimer reaction. That's the doctor who discovered this ability for pathogens when they start being killed to actually release more toxins than they normally would when they're not trying to be killed. So you feel worse on that product or protocol. You want to manage feeling worse. It's about what can you do? You don't want to completely make yourself feel horrible. So you can actually take supplements to help manage that die-off and detox. And there's strategies behind that too. It's not just the supplements. And I teach you those strategies in what we call our Superwoman supplement strategy inside of the program. And then you want to do all of these protocols, the Vitality, Biofilm Buster, the Powerhouse, the Detox and Die-off Manager for the right amount of time. I will say for C. diff, our process takes 6 weeks with a little bit of buildup, and it also has a special pulsing process to it. So that is unique to us, and it's been super effective in killing C. diff. For our clients, they don't need antibiotics, and they feel great afterwards. So signs of a bad protocol. It's going to be antibiotics only. There's no vitality protocols beforehand. There's no other, you didn't get any other pathogens checked for. I've never seen C. diff alone. C. diff chronically hangs out in an immune system that is depleted. So you want to be looking for what else is depleting it. Is it H. pylori? Is it a parasite? Is it mold? Candida and SIBO are both results of having a depleted immune system. And if you want to know more about those two pathogens, you can check out the episode straight previous to this one. And there's going to be a SIBO episode and a Candida episode, and I kind of dig more into those there. Other issues is you only have biofilm busting herbs. I already mentioned these, the oregano oil, the olive leaf extract. There's a bunch of different options. I'm not really going to list them all out. But the big thing is that if you don't have any powerhouse supplements for whatever protocol it is, it's really hard to kill it. And even if you have a powerhouse supplement, if you don't have a vitality boosting protocols beforehand, even that can be the failure point in that protocol not being successful. Let's see, other issues of a bad protocol for C. diff, you don't do it long enough, and then there's no pulsing done. I find that the pulsing has been super, super helpful, our specific pulsing strategy, which you can get, again, inside our program. When you join the program, you don't just get a C. diff protocol. You get our vitality protocols. You get access to lab testing and wholesale pricing. You get access to any other protocol you could possibly need. Our exact pathogen protocols, heavy metal protocols, in the order you should do it, how long you should be doing it. You get an extremely clear plan to clear out every single room in your the metaphorical rooms in your house, so you can stop having or the house of your body, so you can stop having your symptoms. Because here's the thing, even if you had our exact C. diff protocol or a practitioner gave it to you, you might not have results if you still have other pathogens in your body. If you didn't have enough of an immune system support from your own immune system because you didn't have any vitality protocols. So it's really a big picture. So the only food recommendations I have with C. diff, and this is not quite food, but it's ingestion, is to stop. If you know you have C. diff, don't take acetaminophen, which is Tylenol. So C. diff takes up the same detoxification pathway as acetaminophen. So Tylenol, Dayquil, NyQuil, Excedrin. So for the duration of having C. diff, and especially during the protocol for C. diff, I recommend that my clients don't use acetaminophen as a painkiller specifically. So replacement painkillers examples are going to be naproxen, like Aleve, or ibuprofen, like Advil. So those are going to be things that won't take up that same detoxification pathway and will minimize the amount of detox and die-off you'll have. The order that I recommend you do C. diff in is I usually will do this pathogen the fifth, fifth in order. So H. pylori is the first pathogen you want to make sure you do or don't have. And if you do, it's the first pathogen you kill, then Candida. SIBO, if you listen to my SIBO episode, you actually learned that I don't really have a protocol for it because the whole Better Belly Blueprint process is the protocol for SIBO. It's really about getting to SIBO's root causes. If that's blowing your mind, go listen to the episode. Then parasites, and then C. diff, right? So I really like to build up to C. diff because it is so gnarly to kill. So a summary, I've kind of said all these before, but reasons that a C. diff protocol is going to fail. And you might not know if the C. diff's gone or not, but you can know if your symptoms are gone. It's a pretty easy one. So reasons your symptoms are not gone after a C. diff protocol is, number one, the biggest reason is no one's looking for C. diff for you. So you don't even know you have it. Number two is that they're antibiotic resistant. So you were given antibiotics and they might have not worked. Number three is that you had a very weak, or what I call poorly structured herbal treatment, meaning maybe there was just biofilm busters in it. Maybe there was just soothing supplements in it, but no powerhouse supplement, no pulsing. It wasn't the right amount of time. Whatever it was weak or poorly structured herbal treatment. And then reason number four is that you have other pathogens and toxins going on. And I actually call that the 5 toxin trap. And I talk about the 5 toxin trap in my training to teach you about why the Better Belly Blueprint works. Just go to betterbellytherapies.com/training or click the link in the show notes and you can learn about the 5 toxin trap. And again, how and why the Better Belly Blueprint works when nothing else has. I'm super adamant that this is the crux. And what's going on is that people are not getting good information. And so they're bouncing from practitioner to practitioner who's still doing basically the same thing as the previous person, but they're testing for something new. But they're still not doing a holistic, big picture look at somebody's health. And that's what we've refined into literally a process that you can do yourself. You can get coaching support add-on if you want coaching support. We've had clients do this on their own completely, and I can do it for you myself if you want to be one of my VIP clients. I take on just a limited number of people every month where you can work with me one-to-one as a Better Belly VIP client. I can tell you right now, I only have 7 slots left for the rest of 2024. So if you want to work with me directly one-to-one, have me analyze your labs, pick your labs, build your customized health plan, tell you exactly which protocols to do, modify them to perfection, then without you having to spend a single ounce of your time doing that, then you can go to betterbellytherapies.com/VIP. You can book a free 20-minute application call to make sure this is right for you. Or if you're like, I know this is right for I want one of those 7 slots, then you can just go click in the show notes to join Better Belly VIP as a client. It's option number 2 in these show notes, which is work one-on-one with me as a Better Belly VIP client. So I hope that super helps you guys and gives you some clarity on C. diff. It is not hard to kill. It is not a mystery. You just have to find it. You have to make sure you're not only looking for it, you're not just treating it, but you're looking at other pathogens. You give it the right protocol and it's gone. I guess I did promise 2 other stories for you guys that I meant to mix in. So another client that I had for C. diff, if you guys like stories, she had a history of 3 back surgeries and 2 hospital stays for giving birth. And she'd had health issues for a couple decades by the time she met me that nobody could figure out. She'd worked with, she actually traveled for work. And so she would always take the opportunity to visit the best conventional and alternative clinics when she did that. So she'd been to Mayo Clinic, Johns Hopkins Clinic. She'd worked with top functional practitioners. No one had been able to help her. She had really bad insomnia, bloating, pain, skin issues. She had it all. I mean, she had a little bit of everything and it really sucked. And at the same time, she was a full-time working mom and giving it her all, and she just wanted her body back. And so we did a round of testing. We found a bunch of stuff, but that included C. diff. And we really think that C. diff probably she got from one of her hospital stays, which she had several of. I know that she said that it was her second child that she gave birth to that her health really plummeted. So it's possible it was that one in particular. We don't know. And then the next notable C. diff client came to me. Her main symptom was extreme anxiety. She was a grad student, so she was about to graduate. She was finishing up her exams and applying for jobs. And so she had a lot of potential causes for anxiety, but I mean, it was debilitating. She'd been working with a counselor for multiple months. She'd been trying medications to try and manage it, and it still just felt like it wasn't touching her anxiety. It lasted all day, every day. She woke up with it, went to sleep with it. I mean, she was going crazy. So her counselor recommended, why don't you just get someone to look at your gut, someone who specializes in it? Maybe it's coming from your gut, which is kudos to that counselor. And I mean, she got so lucky she came to me because a very common issue is you might go to a nutritionist or a GI doc and they're not going to look for these things. Well, She said she had extreme anxiety, and I immediately thought, this was a couple years into my practice. I'm like, well, we have to check for C. diff. We have to check for it. Sure enough, she had C. diff, and she had a history of spending 2 or 3 months in a C. diff ward as an intern, doing some type of like note-taking in a hospital. And so we're pretty sure she got it then. We got rid of the C. diff, and her anxiety slowly started going away. It was, it used to be all day, every day, and then it was 3 months at a time, or 3 weeks out of a month, and then 2 weeks out of the month, and 1 week out of the month, and then pretty much only had a little bump in anxiety rise, like a little one, around her cycle, around menstruating. And that was it. She was totally pretty much back to normal. We did a couple things other than C. diff to work on her body detoxing toxins around menstruation, and even eventually even that part of her cycle. It was within a 3-month period. She could have periods without any anxiety, fatigue, cramping. She had no issues. Just a super, super awesome client story. And that's pretty common, honestly, with my C. diff stories. They're just so magical because so few people are looking for them. And we do it so thoroughly. It's not just looking for it. It's all the prep work, all the other pathogens we kill, and then all the healing protocols after killing a pathogen to restore the body to where it used to be. Those were my stories. Sorry I didn't mix them in sooner. But again, would love to work with you. You can come join us in our group coaching program and course, The Better Belly Blueprint, by going to betterbellytherapies.com/training. You can watch the video. If you know you want to join, just scroll below the video and you can join at the bottom of the page, or work one-to-one with me in Better Belly VIP, where you get access to the entire Better Belly Blueprint course, but I basically do it for you. So you just save a bunch of time. All right, guys, I hope you enjoyed today's lesson, and I'll see you guys next week for our next pathogen, mold. Hey friend, I hope you loved this episode. If you've been a fan for a while or newly loving this podcast, can you do me a favor? Drop into Apple Podcasts and leave me a review. When you leave a review, you do so much. You help me know you're listening. You can tell me what you're loving so I know what to make more of. And you help others by boosting this podcast so other people like you can find the podcast too. I mean, it's a win-win-win, right? So if you want a way to pay it forward, just go to Apple Podcasts or click the link in my show notes and leave a rating and review. And if you want some more free stuff, just head over to my free Facebook group, betterbellytherapies.com/Facebook, and you can get access to all of my free support for you, including some Facebook group exclusive stuff like my podcast episode vault, where you can search the Better Belly podcast by topic and find exactly what you need to expedite your healing. I cannot wait to see you in there. Catch you guys next week.